First of all, maybe we talk about, how are the patients actually categorized based on their severity? So would you like to share a bit on this part?
Basically, in Malaysia, based on our Ministry of Health classification, there are 5 categories. Cat 1 is for people that are asymptomatic, means you don't have any symptoms, but somehow during the screening, you are tested positive. Now, Cat 2 people are people with some symptoms, right? So for example, flu, cough, sometimes headache also is part of the symptoms, fever, loss of taste, loss of smell. Cat 3 is when there are symptoms of pneumonia. Pneumonia simply means lung infection or chest infection. So maybe some form of breathing disturbances, a lot of phlegm, high spiking fever. Cat 4 is when they need external oxygen, because people at Cat 4 simply cannot sustain the level of oxygen the body needs anymore. So if it's less than 95%, means this person is oxygen deficient, not enough oxygen already. All right. So then external or supplement oxygen must be given. Cat 5 is when they need ventilator. Now, ventilator is when the person is put to sleep and a breathing tube is put into the lungs directly and also connected to what we call a ventilator, a mechanical breathing machine that pumps in the air to the lungs. Because this category of people, the external oxygen is not enough. The oxygen must be pumped right into the lungs. Ideally, Cat 4 and Cat 5 should be managed in hospital setting, and Cat 5 especially needs to be in ICU setting.
From your point of view, how do you think the vaccination will help in preventing patients into going to Cat 4, Cat 5 straight?
When I say vaccinated patients, means those that have completed 2 doses. Right, and after 2 weeks after completing 2 doses, this person is considered fully immunized. Right, a fully immunized patient very rarely goes into Cat 4 and Cat 5. That means they don't really need the oxygen. That shows that the vaccine is actually working. Doesn't matter which type of vaccine, all have this kind of protective effect. But the thing is, when a person is vaccinated, it doesn't mean the person cannot carry the virus anymore.
Correct.
You can still be a carrier. You can still spread the virus. It's just that with the vaccination, right now, the effect that we are seeing, it reduces the severity of the disease, and also it reduces the risk of death. So vaccines definitely work. I'm seeing it with my own eyes, with my own patients. Even 1 dose makes a difference as well.
Do you mind sharing what usually they can expect when they are post-discharge from the hospital?
Yeah, so we are now currently seeing a lot of cases which are long COVID.
Yeah.
All right. Right. We know that COVID stays around for 14 days in the body. Some people that have immunocompromised, maybe the COVID will stay in their body for up to 21 days. But the after effect of the active infection, it's called long COVID. What COVID does to the body is it damages our lung cells. Then the oxygen exchange in the lung is also compromised as well. So what happens is when a person has active COVID, the lungs become inflamed, inflammation. Once the lungs are inflamed, some cells are damaged, right? So for younger people, their recovery ability is better. Sometimes even 100%, they can make a full recovery. But for older people, when they get infected with COVID and their lungs go inflamed and the cells start to be affected, then their recovery is very slow or much slower. Hence the long COVID, hence the complications that we are seeing in people that are in the recovery phase of COVID, right? So when these people are discharged back home, because the lungs is not functioning at full capacity as before, they are bound to experience different types of complications. We are seeing breathing difficulty. We are seeing people that are easily tired, easily lethargic. So our strength may reduce, our stamina may reduce, our activity level, our tolerance level, our exertion level will all reduce as well as a result of the lung damage, of the lung inflammation. It's not an easy process to go through. It's very traumatizing for people that are being isolated for after such a long period of time. It's easily to spiral into depression as well.
Yeah, sure.
So if you know of someone that is recovering from COVID or has recovered from COVID, please give them the support that they need as well, not just physically but also mental support. Interacting with them, encouraging them. I think all these things, small or big, makes a difference.